This presentation is intended to cover Phase 4 Revitalization of the State of Illinois' Restore Illinois Response Program to COVID-19. The revitalization phase of the Restore Illinois public health approach to reopening the Illinois economy will include larger gathering sizes. The additional businesses will be able to reopen and have increased capacities. We must all continue to social distance, frequently wash our hands, and cover our faces to maintain progress in overcoming COVID-19. All the guidance within this presentation is found on the Department of Commerce and Economic Opportunities website under their COVID-19 Resource Center. This presentation has been prepared for ILCA members to be shared within their organizations and with their teams. First, a disclaimer. These materials have been prepared by the ILCA in accordance with materials available on the DCO's website. These are summarized as a courtesy to members with the guidance available on the date of issue. ILCA accepts no legal responsibility for anything within these training materials. Further, this guidance may be subject to changes, and it is up to each employer to incorporate changes into the guidance over time. Employers may modify this document, but accept all responsibility for modifications. The state of Illinois recommends that all businesses provide an employee training program that covers the following topics. All of these topics are included within this short 20-minute training session that can be shared with your employees. There is an online toolkit available on the Department of Commerce and Economic Opportunities website. This will contain business guidelines, industry posters, checklists, a wellness checklist, industry signage, and social media graphics. Not everything that is recommended to be included in the employee training program is found on the DCO website. Therefore, the ILCA utilize resources such as the Center for Disease Control and OSHA to supplement the training program. When these resources were utilized, it is indicated on the slide. First, on the website, there are two industry posters, both one in graphic format and one in text format. These are not required, but may be posted in visible locations. These have not changed from Phase 3. There are two checklists, one for employers to complete and one for employees to complete, to ensure that proper protocols are in place on the employer side and proper protocols have been explained to the employees on the employee side. There is an employee wellness screening checklist that can be utilized when determining an employee's wellness. It does recommend that you utilize this wellness screening twice a day, but it will be up to each individual organization to determine how to use the checklist and if and when to use it. There are 29 different signs that can be used in various locations around an office. These can be posted in both public spaces and in private spaces to let people know what the guidelines and rules are using templates already provided from the state. In addition, there are 24 social media graphics that can be formatted for Facebook or Twitter to demonstrate your organization's commitment to health and safety. These can be shared externally with your customers or internally with your employees and your team. This information is provided by the Centers for Disease Control and Prevention. It discusses the sources of exposure to COVID-19. It will look at two primary ways that COVID-19 can be transmitted, either person-to-person transmission or by individuals encountering surfaces or objects that have previously been contaminated with the virus. OSHA has broken hazard risk exposure into 4 levels. These levels are a very high, high, medium, and lower risk, as shown in the occupational risk pyramid to the right. Most office and field workers who do not come into contact with the general public will find themselves in the low risk category most of the time. There may be examples where landscape or supplier employees would enter into the medium risk category, and that may be frontline labor positions that interact often with the general public. The high risk and very high risk categories are reserved for medical professionals and mortuary professionals. The Restore Illinois Phase 4 guidelines are broken into 7 sections. These 7 sections will be explained in more detail in the following slides. This information will be applicable to businesses that meet the following criteria. They conduct operations from within non-customer facing office spaces, and examples of these could be legal services, accounting services, architectural, engineering, design, and yes, landscape services. These are uniform guidelines that go across businesses, industries, and nonprofits within the state of Illinois. As of the release of Phase 4 Revitalization, offices may continue to operate at a maximum occupancy of 50%. Capacity restrictions will be reassessed based on the latest science and public health metrics on an ongoing basis throughout Phase 4. This is the same recommendation that was in Phase 3. It still recommends that all employees who can work from home should continue to do so. Employees should wear face coverings over their nose and mouth when social distancing is not able to be followed. Exceptions may be made where accommodations are appropriate, and the Illinois Department of Public Health does provide guidance. Unfortunately, this guidance is mostly for businesses who interact with customers in a retail environment, so it will be up to each individual business to determine how it will account for accommodations that need to be made for employees who are unable to wear masks due to a documented reason. Social distancing of at least 6 feet should be maintained between non-household individuals unless participating in activities permitted under Phase 4 guidelines. Employers should provide hand washing capability or sanitizer to employees and, if applicable, to customers. It should also encourage frequent hand washing by employees and to make sure that the office is providing an adequate supply of soap, paper towels, disinfectant, and hand sanitizer should be made available. Now for HR and travel policies. All employees should complete health and safety training related to COVID-19 when initially returning to work. Those resources are found on the DCEO Restore Illinois Guidelines website. Additionally, in Phase 4, the state recommends that employers appoint a team, both made up of management and representatives of the employee base, to make sure that guidelines are being updated and followed. Employers should still recommend that all non-essential business travel be limited, and if an employee must travel, they should follow CDC considerations. Most of the CDC considerations that are provided on their website involve air travel. Employees should not report to or be allowed to remain at work if sick or symptomatic. The following are just a handful of symptoms that the CDC has identified as being the most prevalent in COVID-19 cases. Also, Sick or symptomatic employees should be encouraged to seek a COVID-19 test at a state or local testing center, healthcare center, or other testing location. Tests are much more prevalent than they were 90 to 100 days ago, and therefore, sick or symptomatic employees should be encouraged to get testing whenever possible. There should also be reasonable accommodations made for COVID-19 vulnerable employees. That should start with being allowed to continue to work from home if feasible. But also, there are other recommendations such as reducing contact with others, using barriers to ensure minimum distancing, or other accommodations that reduce chances of exposure. Employers should make temperature checks available for employees and encourage their use. Employers should post information about the symptoms of COVID-19 in order to allow employees to self-assess whether they have any symptoms and should consider going home. Employers should also have a wellness screening program, and resources outlining screening program best practices are posted on the DCO Restore Illinois website, and that wellness screening program form is in both the Phase 3 and Phase 4 toolkits. Employers should conduct in-person screenings of employees upon entry into the workplace to verify there's no presence of COVID-19 symptoms. Employers may also want to conduct a mid-shift screening to verify any presence of COVID-19 symptoms. If an employee does contract COVID-19, they should remain isolated at home for a minimum of 10 days after the onset of symptoms and can be released after feverless and feeling well for at least 72 hours, or they have had 2 negative COVID-19 tests in a row with testing done at least 24 hours apart. If an employee is identified as being COVID-19 positive by testing, then the CDC cleaning and disinfecting should be performed as soon as possible after the confirmation of a positive test. And when appropriate, additional employees who have been exposed should be notified. Any employee who has had close contact with a coworker or any other person who is diagnosed with COVID-19 should quarantine for 14 days after the last or most recent contact with the infectious individual and should also seek a COVID-19 test at a state or local testing center. All other employees should also be on alert for symptoms such as fever, cough, shortness of breath, and should take their temperatures if symptoms develop. Now on to the physical workspace. If a multi-tenant building, the landlord should display signage at building entrances with face covering requirements. They should display visual markers 6 feet apart at queue points, such as at elevators, entrances, or in restrooms. You should limit elevator capacity to allow for 6 feet of social distance whenever possible, and there should be hand sanitizer at building entrances, elevators, and at common areas. Within the office, if practical, avoid seating employees facing each other. You should encourage employees to keep a clean desk and remove personal items. If practical, the office should look at its traffic flow to minimize contact. It should also reduce the use of shared workspaces. And it should reduce surface contact via no-touch doors, elevators, provide disposable desk or keyboard covers for any shared workspaces. Should minimize the use of shared work materials and equipment such as a copier. If practical, reduce the use of shared paper and encourage more digital tools. Limit telephone receivers to 1 receiver per person or allow them to use their mobile phone. Where building management practices allow, try to increase air turnover rate in occupied spaces. The CDC also provides a definition for high-risk individuals High-risk individuals are those in which accommodations can be made so that they continue to work in a safe and sanitary environment. This would include individuals over the age of 65 or those with underlying medical conditions that include but are not limited to the following. It is likely that this list will change as more is learned about at-risk populations and the impact of COVID-19 on them, so employers must stay on top of any new CDC developments. Now, disinfecting and cleaning procedures. Cleaning and disinfecting of premises should be conducted in compliance with CDC protocols on a weekly basis. It is especially important to clean and disinfect common areas and surfaces which are touched by multiple people. It is recommended this should be done every 2 hours for high traffic areas. Workstations should be disinfected by employees upon entering the office and before leaving for the day, with cleaning products provided by the tenant. Staffing and attendance. It still recommends that the maximum occupancy should be 50% for any office. If this is a multi-tenant building, a landlord should design a plan to allow for social distancing within common areas. And employees should be identified who could monitor capacity limits and social distancing. The landlord and tenant should limit the occupancy of common areas and break rooms to allow for social distancing. It should also consider staggering break times, so to diminish the amount of employees within a break room at any given time. If practical, you should still use tele and video conferencing while at desks. You may want to consider coordinating employee arrival and departure times to adjust for limited capacity in public spaces. Should minimize the number of in-person meetings. If in-person meetings are necessary, Phase 4 allows for a limit of 50 people to be in place with social distancing. And also to implement a process or tools to ensure employees are aware of available capacity before beginning a commute. Finally, to stagger shift start and end times to minimize congregation of employees during changeovers if you have multiple shifts. Now, external interactions. Before allowing external supplier or visitors to enter, or while requiring to wait in a designated area, the tenant should ask these individuals whether they are exhibiting any COVID-19 symptoms. If practical, you may take the external supplier or visitor's temperature using a thermometer. If it is a multi-tenant building, it is the landlord who is responsible for screening at the loading dock. And the tenant should keep a log of all external suppliers and visitors who enter the office. Suppliers and visitors should wear face coverings over their nose and mouth when entering the premises. And whenever possible, you should limit contact between external suppliers, visitors, and your employees. If you have any questions or need additional support, please call the Department of Commerce and Economic Opportunity directly at their hotline. You may email them, or you may visit their website. There are also additional resources that are linked from the DCO webpage. This presentation specifically is not found on the DCO website and instead is a creation of the Illinois Landscape Contractors Association as a courtesy to our members. That covers Phase 4, Revitalization of the Restore Illinois program. Thank you, be safe, and keep taking care of each other, and the ILCA will keep taking care of you.